Mental health experts and grifters, are they helping or hurting? The tyranny of the childhood obsession. Walk into any therapist's office today and within minutes, one will likely be asked, "Tell me about your childhood." It's treated as an unquestionable truth. The past holds the key to present suffering. But does it? And even if it does, is excavating old wounds the most effective way to heal, or merely the most familiar? Childhood undeniably shapes individuals, but when therapy reduces every adult struggle to a parental failing, an overbearing mother, an absent father, or a misunderstood sensitivity, it risks turning people into permanent victims of their past rather than empowered architects of their future. Worse, this focus often becomes a self-fulfilling prophecy. The more someone is taught to view their life through the lens of childhood wounds, the more they see those wounds everywhere, even where none exist. The science, or lack thereof, behind digging up the past. Therapists often defend this approach as evidence-based, but how solid is that evidence? Yes, serious childhood trauma like abuse, violence, or extreme neglect is linked to mental health struggles later in life. But jumping from trauma matters to every emotional issue is the parent's fault is a significant stretch, and most solid research doesn't support that idea. A 2014 study by Saunders and Adams conducted a meta-analysis of existing literature and found that while severe abuse in childhood does raise the risk for mental health problems, most people who had a tough but not abusive upbringing don't end up with serious psychological issues. This suggests that people are more likely to be resilient than damaged. The most effective treatment for anxiety and depression today is cognitive behavioral therapy, or CBT. It doesn't focus on digging into childhood. Instead, it helps people recognize and change the negative thought patterns they're dealing with right now. Research by David and colleagues in 2018 showed that CBT works best because it's focused on the present, not on trying to uncover old memories. Still, many therapists continue using older Freudian-style methods that delve deep into childhood, even though CBT has better research behind it and leads to more people actually getting better in clinical trials. Meanwhile, family estrangement is on the rise. A 2020 study in the Journal of Family Psychology found that 27% of American adults are estranged from a parent. That's double the rate from 2010. What changed wasn't a sudden epidemic of abusive parenting, but rather a therapeutic culture that often frames unhappiness as inextricably tied to childhood experiences. It's worth remembering the recovered memory debacle of the 1990s, when thousands of patients were convinced they'd repressed horrific childhood abuse, only for many to realize, too late, that these memories were implanted by overzealous therapists. The same dangerous suggestibility now fuels much of the toxic parents industry. This isn't to say exploring the past is never useful, but when it becomes the only tool in a therapist's toolbox, one should ask, is this science or just habit? Science versus suggestion, the weak link between childhood and adult struggles. According to a landmark study by Felitti and colleagues in 1998, only about 10 to 15% of people who had difficult childhoods end up with serious mental health problems. Yet this nuance is often lost in therapeutic settings, where personal struggles are frequently attributed to parental influence. Cognitive behavioral therapy, the most research-backed treatment for anxiety and depression, focuses on current thoughts and behaviors rather than extensive childhood exploration. Nevertheless, many practitioners continue employing past-focused approaches despite their weaker empirical foundation. Psychologist Elizabeth Loftus's research demonstrated how easily false memories can be implanted. In some of her studies, up to 25% of participants formed detailed memories of events that never occurred simply because someone suggested them. A parallel phenomenon may be occurring with the current toxic parent trend in therapy. When a therapist suggests, "Perhaps your parents emotionally neglected you," clients often begin remembering supporting evidence, even if they'd never conceptualized their experiences that way before. A 2023 paper by McNally in Clinical Psychological Science warns about entering what he terms Memory Wars 2.0, fueled by trauma-focused therapy that sometimes blurs the boundary between genuine experience and suggestion. Dr. Jonathan Shedler, a psychologist at UC San Francisco, states it directly. "A lot of therapy today isn't really about healing. It just keeps people focused on their symptoms and stuck in self-analysis instead of helping them make real changes." The rise of the grievance grifters. Why does the childhood-centric model persist? Financial incentives play a role. Therapy's business model can benefit from client dependency. A patient who discovers new childhood wounds each week remains in therapy for years. Quick, solution-focused care doesn't generate the same revenue stream. Social media's outrage economy is another factor. Viral therapists peddle sound bites like, "Your parents emotionally neglected you," because outrage drives engagement. Balanced perspectives rarely go viral, but parent-critical content does. According to a 2023 Pew Research study, posts criticizing parents get shared 5 times more than posts presenting balanced perspectives. There's also a kind of power in assuming the role of the wounded party, what might be called the victimhood premium. When someone positions themselves as a victim, especially blaming parents, it can justify cutting people off, avoiding responsibility, or expecting others to constantly accommodate them. The more someone frames their pain as another's fault, the easier it becomes to feel entitled to escape accountability. Researchers Campbell and Manning explored this in their 2018 book, The Rise of Victimhood Culture. They explain how modern society often rewards victimhood identification through attention, support, or sympathy, a form of social currency. This can lead people to interpret ambiguous or minor situations in ways that cast them as the wronged party. A 2022 study in social psychological and personality science found that people who externalize blame may experience short-term self-esteem benefits, but typically develop less emotional resilience over time. Unfortunately, much of contemporary therapy culture exacerbates this issue. It often reinforces blame rather than fostering growth beyond it. This isn't therapy. It's grievance marketing, and it's creating a generation who equate healing with blaming rather than growing. How therapy can create estrangement. Many therapists fall into a pattern of treating every emotional issue as necessarily rooted in parental failings. It becomes a childhood wound-digging trap. Questions are framed to lead clients in predetermined directions. Did you ever feel unheard as a child? Who hasn't? Or did your parents ever dismiss your feelings? All parents do at some point. What begins as normal reflection can rapidly transform into a full-blown trauma narrative where typical parenting gets reframed as emotional abuse. Consider this actual example. A 25-year-old discusses anxiety with her therapist. The therapist asks, "Did your parents ever pressure you to succeed?" Suddenly, encouraging statements like, "You can do it," get reinterpreted as, "They only cared about my achievements." What once felt supportive now appears harmful. Then comes the no-contact prescription. Some therapists default to extreme advice. "You need space to heal," or "Toxic people don't deserve access to you." But when applied to non-abusive parents, this isn't therapy, it's emotional malpractice. A 2022 survey by Coleman and Pillemer found that 61% of therapists reported recommending cutting contact with family members at some point in their practice, but only 13% reported following up with structured assessments of whether this improved their clients' well-being long-term. This suggests many estrangement recommendations occur without evidence of their efficacy. A son tells his therapist his father was critical. Instead of exploring reconciliation, the therapist says, "You might need to set hard boundaries." 6 months later, the son ghosts his dad. Finally, confirmation bias solidifies the narrative. Once a therapist suggests, "Maybe your parents were narcissistic," the client begins filtering all childhood memories through that lens. A mother forgetting a birthday card becomes, "She never cared about me," and a father coming home tired from work transforms into, "He was emotionally unavailable." The more these interpretations are discussed in therapy, the worse the parents seem, even if they were reasonably competent. Psychologist Raymond Nickerson explained this in his seminal research on confirmation bias in 1998. It's a cognitive tendency where people emphasize information supporting their existing beliefs while discounting contradictory evidence. In therapeutic settings, this becomes particularly problematic without practitioner intervention to encourage multiple perspectives. Without such balance, neutral or even positive memories can be reinterpreted as evidence of emotional damage that wasn't actually present. Why this is happening now? We're witnessing trauma-informed overreach. Trauma therapy is vital for actual abuse survivors, but increasingly ordinary stress is being labeled as trauma. Emotional neglect gets redefined as parents who didn't anticipate every emotional need. Parentification becomes a teen who occasionally babysits siblings. The result is a generation convinced they're survivors of hidden abuse. Social media significantly amplifies these tendencies. TikTok and Instagram therapists spread oversimplified slogans like "cutting ties is self-care, and if they wanted to, they would." These sound empowering, but they pathologize normal family conflict. Research by Zumaida Garcia, 2023, in the Journal of Social Media Studies found that therapeutic content on social platforms tends to be dramatically oversimplified, with 76% of popular therapy-related TikTok videos making claims that would be considered inappropriate generalizations in clinical settings. The study also found that videos promoting family estrangement or labeling parents as toxic received 3.2 times more engagement than content promoting reconciliation or nuanced approaches to family conflict. The financial incentive cannot be ignored. A client who discovers new childhood wounds weekly translates to years of therapy bills. A client who reconciles with their parents represents lost revenue. But some parents are toxic. Absolutely, some parents are abusive and estrangement is necessary in those cases. But there's an overdiagnosis problem. Terms like narcissistic parent and emotional neglect are now applied to normal parental mistakes. Missing a school play isn't neglect, it's life. There's also a double standard at play. Adult children demand unconditional love, but often give conditional acceptance. One argument, one misunderstanding, can trigger permanent exile, and there's a no-exit policy. Even criminals get parole hearings, but parents accused of toxic behavior are given no path to redemption. The devastating impact on parents. Parents face false accusations, being labeled toxic or narcissistic, with no chance to defend themselves. They endure permanent exile. Unlike with real abuse victims, these adult children often refuse mediation or dialogue. They experience grief without closure, mourning living children who treat them as dead. The alternative, forward-focused healing. Real growth doesn't come from endlessly dissecting the past. It comes from accepting imperfection. Parents aren't flawless. Neither are their children. That's normal, not traumatic. It requires building agency. One can't change their childhood, but they can change how they respond to it today. And it demands choosing responsibility. It's easier to say, "My parents ruined me, then I need to work on myself." Only one leads to freedom. The best therapists help clients transcend their past, not wallow in it. This approach is backed by solid research. Studies on post-traumatic growth, such as the work of Tedeschi and Calhoun in 2004, show that genuine healing comes from finding new meaning and purpose, not from remaining fixated on past trauma. Research by Bonanno in 2004 also found that most people naturally recover from even serious challenges without requiring extended therapy. This challenges the notion that everyone must process their trauma through deep exploration of old wounds. In fact, a 2015 study by Wampold and Immel demonstrated that therapy focused on building personal strength and addressing present problems tends to produce better long-term outcomes than therapy primarily centered on childhood pain. A call for reform. Mental health professionals can do better. They must stop treating exploring childhood as a mandatory first step, acknowledge that not all family conflict constitutes trauma, and challenge clients who use therapy as a blame avoidance tool. Otherwise, they're not healers, they're grievance enablers, and the casualties will be families. Therapists should adopt solution-focused models like CBT or acceptance and commitment therapy that build agency, not victimhood, and challenge clients who use therapy to avoid accountability. Parents need to reject the toxic label if it doesn't fit. Imperfection is allowed. They should demand mediation. If their child insists they're abusive, ask for a joint session with a neutral therapist. And speak out, as silence fuels the stigma. Share your story. As a society, we must question viral therapy trends. Real mental health progress rarely fits in an Instagram reel. We need to restore forgiveness. If everyone exiles those who've ever hurt them, we'll all die alone. This isn't about ignoring genuine trauma. It's about pushing back against the tendency to treat everyday family problems like serious mental illness to sustain the therapy industry. Therapy's purpose shouldn't be keeping people locked in their pain. It should help them move forward, and that begins with remembering something our culture has lost. Real growth requires both accountability and forgiveness, not just blame assignment. The reconciliation approach, an evidence-based alternative. Despite these concerning trends, promising approaches are emerging from family therapy research. The family reconciliation model, developed by Sharp and Thomas in 2018, has demonstrated success in healing divided families. In their 5-year study, they found that when estranged family members participated in structured reconciliation therapy with trained professionals, 64% were able to rebuild meaningful relationships. What distinguishes their approach is the inclusion of both parent and adult child in the process, with each party given equal opportunity to speak and be heard with respect. Coleman's work on ambivalent reconciliation, published in 2020, offers another perspective. His research indicates that estrangement need not be permanent. In many cases, relationships can be repaired through clear boundary setting and expectation adjustment. Families who maintain contact within improved structures often report greater life satisfaction than those who remain completely disconnected. The essential insight from this research is both simple and profound. Even imperfect connection typically supports well-being more effectively than complete disconnection. This challenges much contemporary therapeutic discourse, where severing relationships is frequently presented as the primary healing path.